Hello. Dr. Brajesh.
Hello. Hi, Rajesh
जी
ji.
नमस्कार
Hello.
सर.
Ji. Namaskar, sir. We can hear you okay. Can you hear us all right?
जी सर.
Ji, perfect. So,
Okay.
हम 1 minute में we can just start, I think already. We have enough number of people. We are recording this session. Good afternoon, everyone. My name is Rohan. I'm joined by my colleagues Ria and Deepti, and together we help facilitate Gender Collab. And we are really pleased to invite all of you to our first Gender Collab dialogue. Uh, just before we begin, we'll start with some ground rules. We are recording this session just for purposes of documentation. We request everyone to please introduce themselves and the name of their organization in the chat box. That'd be really useful for us to just get a sense of the audience here. Please feel free to leave comments and questions in the chat box as we go along. So we'll also keep a track of that. We are really pleased and grateful to be doing this in partnership with PCI India today. PCI India is one of the members for Gender Collab. Gender Collab is a community of practice that is really set up to advance gender intentionality in the health system. It's anchored by Oxford Policy Management and facilitated by Quicksand, and it's made possible with the support of the Bill and Melinda Gates Foundation. Just 1 second, should be able to. Great. You can find more details on our website, which is www.gendercollab.in. Gender Collab is a space where we are collating knowledge and evidence of how different practices can be used for more gender transformational work in the health system itself. So there's a knowledge center that has several reports, etc., that you can go through. There's a reflections page for blogs, and we've also been hosting learning events. These learning events in the past have been around enabling respectful care within the health system, women's leadership in health, as well as nurse leadership. And today, we're really pleased to launch the Gender Collab Dialogues, where we are hoping that every month we'll be able to bring on a community member from the Gender Collab community to share and discuss things that they are working on or they are passionate about. So without further ado, I'd like to now call upon Ms. Irina Sinha from PCI India to kindly take over and moderate this afternoon. And we're really looking forward to this. Over to Irina.
Thank you, Rohan, and a very good afternoon to all those who have joined us for the session. As has already been mentioned, this is the first of a series of such dialogues that we would be having. And the topic for today's discussion and deliberation is JEEViKA, Swaasthya Mitra and Helpdesk, and very nicely captioned. It does talk about a very smooth bridge between the patients and appropriate public hospital care. Needless to mention that, one important thing that we all need to address is ensuring greater access of the community members to hospital and institutional facilities to actually access healthcare. And we do see that there are a lot of gaps. This particular intervention, which has been started by JEEViKA, is one such effort, and it's a very, very pertinent and important effort, which actually has helped facilitate a lot of access and actually has tried to make access more smoother for people who would like to access health services from the institutions. For today's presentation, I would just like to introduce everybody about the flow and the agenda of this dialogue. So we will have a presentation by Mr. Rajesh Kumar, who is the OST from JEEViKA. Welcome, sir, and thank you so much for taking out time for this important discussion. Who better than you could have done it, sir, because you have also been very integrally involved with the health department in your previous stint. And now in JEEViKA, you are the one who can actually understand how important it is to build such a bridge and such a link. So really waiting to hear from you, sir, on the relevance of this intervention and also on some of the operational details of how this has been rolled out. After your presentation, we will be having Mr. Brajesh Kumar, who is actually the health manager from the Jawaharlal Nehru Medical College and Hospital, Bhagalpur. Let me also inform everybody here that this intervention actually began at Bhagalpur, and the current status is based on all the initial learnings that we have drawn from the Bhagalpur facility. So we are very, very happy to have you, sir, for your experience sharing. Followed by this, we would also bring to you voices from the field. You know, women from the communities who've actually felt the need and who've actually also realized how important and how beneficial such kind of a service can be to them when it comes to accessing healthcare. And needless to mention that, you know, after this interventions, we've also done a very, very rigorous measurement of the entire work. And we have with us Dr. Pragya, who's from AIIMS Patna, and she will be sharing with us the findings and will also be giving us insights of what worked well, what did not work well. So all the lessons we will hear from Dr. Pragya, and I would also like to welcome you to this session. And at the end of it, we will open the floor for discussions and questions. And I would request Dr. Narottam Pradhan, who is the COP for the project here in Bihar, to kind of anchor that session. So with this brief, description of how we would go ahead with today's discussion, may I now call upon Mr. Rajesh Kumar to please make his presentation. Over to you, sir.
Thank you, Rina. Can I have the presentation? Yeah, please start. Please start. Next. So just for the laptop is not working camera. Just give me 1 minute. So initially I want to introduce myself. I was with health for nearly 4.5 years under NHM, looking after the mainly the HR part and being part of the I was the main person reporting for the COVID, and during those my instinct at the health department as a hopefully you can hear us. You hear me? Irina, can
Yes,
you?
sir, we can.
Yes, sir.
Yes. So
Yes, sir.
thank you. So while in health and having a 15 years or more, now it's almost 24 years of field experience in under administration, I got to understand one thing, that to approach a government system for any kind of services is always very difficult. For poor people, for us, for poor people who are coming to take services from the government sector, intervention, whatever they are, it's always very overwhelming for them, especially in health. When you see the health department and the health facilities, the way it is set up, for a person coming from a poor background, they find it very difficult to access the real person or real doctor from where the services can be availed by them. Normally, what has happened in the health sector, we have worked so hard at the supply side of the things. We have made good hospitals. We have built beautiful labs. We have got medicines in our bucket, but still the supply side was very much focused, but the demand side was a missing link between whole what when I was working in health. I found the demand side was one thing that we are not able to cater it. I always wish to join hand with JEEViKA at least to give Philip this demand side thing. Finally, by the God's grace, I'm here at JEEViKA to look at the demand side of the things also. So when you look at the demand side, the first thing is that the person who is services should have those ease of taking services in their hand. For this, I think in September 2022, when the state took this decision to establish Swaasthya Mitra Helpdesk, here, next slide. So Helpdesk at the hospital, both at the government hospital and the private hospital. So, sorry, at the government hospital, both at district hospital and at the medical college level. When this was taken up, normally there was a belief this whole, you'll see one of the hospitals there where this first started at JLMCH Bhagalpur, the Mayaganj hospital. There was a perception that a patient going to Mayaganj alive won't come back alive. So this was the kind of perception that we had of our services that we are offering. So we started in September 2022 with, at present, we are not 11, but 10 medical CH. They have just into that renovation phase. Post renovation will start the medical college services at PMCH and other 35 district hospitals. We are working the Helpdesk services. Next. So normally what has happened when you go to a hospital, our hospital services were also not in for a patient-centric, patient-centric, where they always wanted that more the patient comes to their hospital, the more services will be demanded. And therefore the whole hospital setup was such, they were not welcoming the patient properly. So the main purpose was to let the patient go away. Our main two kind of services that we are offering there, mainly what it was somebody coming for some medicine or maternal health related issues we are dealing in bulk. Apart from maternal health, there was not much services, especially related with tertiary care, and secondary care was not proper. Because of there was no demand push there, so this has to be demand push was not there. The quality of services was also not improving. Then this remarkable thing happened about this Swaasthya Mitra and Helpdesk, that with the help of collaboration with JEEViKA and PCI and health department, this was initiated. Next. Till now, it was a small beginning because see the number of IPD patient is quite more than what services we are still till date we have offered. We have covered nearly 2.52 lakhs of OPD and 56,000 IPD patients in through this Helpdesk initiative. We have also used patient post discharge. We have follow-up services were also offered by the JEEViKA Helpdesk. Next. This next. See the capacity. The best part was this: to have as partner as a very reputed institute like AIIMS Patna and a long-term partner of ours, PCI. We devised a training module which was given by the AIIMS Patna at their facilities, and that included every kind of training that is required for facilitating the patient services at a facility. And we are very happy that the AIIMS has taken this. The healthcare workers were given information about what kind of infrastructure a normal district hospital medical colleges have, what kind of facilities and services that they are being offered at these health facilities, how health emergencies and general emergencies are being handled at these facilities, and above all, what are the communication skill sets that the JEEViKA Mitra should have, so that the patient who is in a distress who are coming to take services are actually offered proper sympathetic services at our facilities. Next. The normally it is said that we offer our services from 6 a.m. till 10 p.m. Initially it was 6 to 6, but due to the services of people are coming, especially the maternal health people are coming post 6, so we extended that period from 6 to from 6 to 6 to 10 p.m. in our facilities in 2 shifts. The SHG platform, here the cadre of the SHGs, CNRP and the MRP cadre was very well leveraged to bring about these services, where the CBO organization, cluster-based organization, cluster level federation, people were given this task of selecting our cadre who will operate as a JEEViKA Mitra or Health Mitra at those facilities. Next. The Swaasthya Mitra, in order to function as Swaasthya Mitra, they were given the phone numbers of doctors and nurses who were operating at the health facilities. They were made to go throughout the health facility to understand where are the various departments which are functioning there, who were the doctors and who were the nurses. They were acquainted with all the doctors and nurses. We were able to take the patient to the concerned pinpoint without waste of much time. Normally, what happens if we are not able to provide services at a quick round of basis, if there's then unnecessary delay in provision of services, there are many other vested interests operating in our government facilities. We take charge of these people, take them to other touts and other areas. To curb that, we ensure that the JEEViKA, Swaasthya Mitra and the health facilities work in close tandem, in close collaborations, so that the services were smoothly given at a short span of time. Next. Now what has happened? Now, always when you see the media, you'll find that somebody is taking their sick one in their lap and running for helter and skelter. There are people, there's negative image of government system everywhere. Despite the fact, I think at many places we are offering wonderful services, but the good services offered by us was never actually was never taken care of by the system itself. We are not projecting ourselves that we are offering good services at the health facilities, but that thing has now come to the JEEViKA Swaasthya Mitras. What they have done is that through proper training and services and normal common health and the families of the JEEViKA members initially, that these DBs, what they do, they bring about the compassion that was lacking in the health system. The health system is very blunt in the sense of offering services. When that compassion part was missing, that compassion part was brought about by these DBs, by Swaasthya Mitra for the patients who were coming to us. And we have developed in order to give this regular services, there was a regular planning aspect was done, where PCI was of great help to us, and AIMS Patna was providing us day-to-day feedback how to handle these things that we are doing it. There was a real-time reporting mobile application has been developed, and people have been trained for this application, and the data is being captured now, so that we can bring about improvement in whatever way we can after studying the services that we are offering. Next. See, looking at the good work that is being done by the JEEViKA Swaasthya Mitras, there is some early learning being taken for this. There is going on by the Brown University in Patna and AIMS Patna. They are looking at this, whether this model of having a kiosk at the hospital gate and making a community-based organization responsible for dealing with this Helpdesk kind of thing, whether that is having any impact in terms of number of patients in terms of number of patients increasing, whether we are having a better access, we are facilitating better access to services to our needy patients who are coming to us, whether the patient satisfaction index have increased or not. All those are part of the studies that is going on. And secondly, there's a when I was in health after, I was looking after the Grievance redressal system also, which was run by the Piramal Foundation. At that time, only the Suman program came, so Surakshit Matritva Aswasan. That actually was main focus, was that there was zero death of newborn or maternal death, just because we are not able to give access to services which were actually available in our system. And we have, and to ensure a proper proper ambulance services to these people also was to be ensured through this Suman program. Hopefully, what I have learned now, that the Piramal is not doing that work in health society now, and most probably JEEViKA will be taking up this Grievance redressal aspect of Suman also. So in that will work on. Next. Thank you. There are many things that needs to be done, but I want the practitioners who have done this, the people who have made about this change, my DDs, we are working as Swaasthya Mitra, our hospital managers who have collaborated well with our JEEViKA Mitras, and they have ensured these services. And of course, our technical partner and our advisor, AIMS Patna, to come up with their opinion. Thanks a lot.
Thank you so much, sir, for this presentation, and just reiterating and taking from the words that you used. Indeed, incredible work of making sure that the medical services become accessible and very smooth. And thank you also for acknowledging the contribution of the partners, AIMS and PCI India. And I would also like to say here that JEEViKA indeed has the passion to ensure that, community members, especially women from the rural areas, get services which is like full of compassion. So I really appreciate, sir, your passion and the entire JEEViKA team's contribution in making this happen. And I'm sure this would really get scaled up. It has already got scaled up, but I really wish that along with the Suman intervention, this kind of gets completely institutionalized within the health department, and there is a strong convergence between health and JEEViKA. Thank you once again, sir, for your presentation. We would now move on to Mr. Brajesh Kumar, who is the health manager from Bhagalpur. And this is where this entire work started. So we would really request you to actually tell us about and give us an overview of the support that you actually received from this help desk, which was being managed by JEEViKA. Mr. Brajesh Kumar.
हेलो
ब्रजेश जी, आप हैं?
जी मैम।
हाँ, आप शुरू कीजिए।
जी मैं जवाहरलाल नेहरू मेडिकल कॉलेज हॉस्पिटल से भागलपुर से मैं हेल्थ मैनेजर ब्रजेश बोल रहा हूँ। JEEViKA स्वास्थ्य केंद्र 30 सितंबर 2022 को अधिकारी भागलपुर एवं अस्पताल अधीक्षक भागलपुर के द्वारा संयुक्त रूप से उद्घाटन किया गया था। शुरुआत में जब JEEViKA दीदी और PCI के लोग जब मेरे पास आए तो मुझे उसकी पूरी जानकारी दी। मुझे लगा JEEViKA दीदी आपस में बात करके लगा मुझे काम नहीं कर पाएंगे, लेकिन जब समय बीता और कुछ समय बीता उससे पता चला कि JEEViKA दीदी हम लोग से सपोर्ट में हैं और काम थोड़ा स्मूथली चलने लगा पेशेंट के संबंधित। JEEViKA दीदी अपना योगदान सुबह 7 बजे से 10 बजे तक देती है। उनका प्रयास रहता है कि हर एक जो भी मरीज आए उनका मजबूती से सहयोग करें। JEEViKA दीदी हेल्प डेस्क पर सभी मरीजों का स्वास्थ्य संबंधी सेवाओं की जानकारी देती है और उनके प्रश्नों का उत्तर देती हैं। मरीज JEEViKA दीदी का जो भी डिस्प्ले बोर्ड लगा हुआ है वो नंबर से भी बात करते हैं और उनसे पूछते हैं, जानकारी लेते हैं, डॉक्टर साहब कब बैठेंगे, कब आएंगे। इसके द्वारा उनको जानकारी मिलती है और बैठे बैठे घर पे सहूलियत मिल जाती है। वो उनका जीविका दीदी जीविका दीदी जब 6 से 10 अपने ड्यूटी में, वो आईपीडी पेशेंट आता है, ओपीडी पेशेंट आता है, ओपीडी पेशेंट को भी वो स्मूथली दिखाना करना, डॉक्टर से दिखाना, और सभी तरह के काम करते हैं उनसे मिल के। इनके द्वारा जटिल पेशेंट का भी इलाज कराया गया है। मेरे द्वारा एक पेशेंट का एक वाकया है, बता रही हूँ मैं। एक एचआईवी पेशेंट थी जिसका डिलीवरी होने वाला था, लेकिन बाहरी प्राइवेट अस्पतालों में सब कोई ने मुझे जवाब दे दिया, जो कि अपने पेशेंट बहुत बेतहाशा थी, बात नहीं कर पा रही थी, किसी से घबराई हुई थी। जीविका दीदी से संपर्क की, जीविका दीदी ने मुझे संपर्क किया, फिर मैंने पेशेंट को बात की डॉक्टर से। एचआईवी पेशेंट का हेपेटाइटिस बी पेशेंट का हम लोग ने भर्ती कराया। उसके बाद उन लोगों का इलाज कराया, भर्ती कराते उसके बाद डिलीवरी करवाई। डिलीवरी के सब मैंने समय जीविका दीदी ने ब्लड का भी अरेंज करवाया, हम लोग साथ मिलके करवाया। उनकी डिलीवरी रूम से बात करके सेवा सुनिश्चित कराई। रात्रि समय जब हेल्प डेस्क में जीविका दीदी का यह प्रयास सफल रहा और इनके कार्य से हम लोग संतुष्ट हैं। इसी तरह जीविका दीदी अपना अस्पताल में सहयोग देती रहे, मेरी शुभकामना है। धन्यवाद।
Yeah, thank you, Brijesh ji.
Thank you, ma'am.
Can we move on? Yeah, can we move on to the next part of the today's discourse, which is showcasing of a couple of documentaries that we have developed.
जी, ये एक स्वास्थ्य मित्र का टेस्टिमोनियल है, मैं वीडियो प्ले करूंगा।
जीविका स्वास्थ्य मित्रा का काम करने से मुझे बहुत खुशी मिलती है। लोगों की मदद करने से, लोग जब आते हैं और परेशान रहते हैं और जब यहाँ से डिस्चार्ज होके जाते हैं, एकदम खुश होके जाते हैं कि नहीं, आपकी वजह से हमारा काम हुआ, हमें इलाज करवाने में कोई दिक्कत नहीं हुई, कोई तरह की परेशानी नहीं हुई, तब मुझे बहुत खुशी होती है। लगता है कि मैंने कुछ अच्छा किया। और यहाँ जितने भी पेशेंट आते हैं, जीविका दीदी लोग जो भी आती है या जीविका दीदी नहीं भी रहती है, उनकी मदद करने की कोशिश करती हूँ। उनका चिट्ठा कटवाना, उनका जांच करवाना, ये सारी काम मैं करती हूँ। और सबसे पहला काम हमारा ये है कि जो दीदियाँ आती है वो घबराई हुई रहती है सीरियस पेशेंट लेके, सबसे पहले उन्हें सांत्वना देना और उसे संभालना है। और उनका चिट्ठा कटवाती हूँ, सारा जांच करवाती हूँ और उनका इलाज शुरू हो जाता है। मैं नई उड़ान CLF से चयनित हुई थी, जिनके लिए मैं 2 दिन के लिए पटना एम्स में ट्रेनिंग करके आई हूँ। पहले मैं जब ट्रेनिंग करने गई थी तो मुझे लगा था कि काम बहुत आसान है, लेकिन जब मैं यहाँ आई मायागंज अस्पताल, इतने बड़े अस्पताल में, शुरू में मुझे लगा कि बहुत मुश्किल काम है। जब हमको लग रहा था कि हम काम नहीं कर पाएंगे, तब जीविका के जो HNS वाले सर हैं और PCI की जो मैडम है, वो लोग हमारी बहुत मदद करते हैं और हमें हमेशा समझाते हैं कि आप लोग काम कर सकते हैं और अच्छे से काम कर पाइएगा। एक बार मैं जिस समय नई ही ज्वाइनिंग हुई थी, यहाँ काम कार्यरत थी, तो एक पेशेंट थी जो गर्भवती थी। उसका मतलब वो एक दिन पहले कॉल की, तो उस दिन मैंने बोला कि आइए दीदी मैं यहाँ दिखा दूंगी, लेकिन वो नहीं आए। उनका ब्लीडिंग शुरू हो गया था समय से पहले और वो उस दिन नहीं आए। फिर मैंने दूसरे दिन उनको कॉल किया, दीदी आप नहीं आए, पेशेंट कैसा है? लेकिन फिर उनका कंडीशन वैसा ही था। फिर मैंने समझाया उनकी माँ को कि लेके आइए दीदी, यहाँ आपको किसी भी प्रकार का कोई दिक्कत नहीं होगा। जब उनको लेके वो आई, उनका 70% ब्लड गिर चुका था बॉडी का और इतना कंडीशन खराब था कि मैं खुद घबरा गई थी और उनकी माँ भी बहुत रो रही थी। मैंने पहले उन्हें समझाया, पेशेंट को समझाया कि आपको कुछ नहीं होगा। और जब मैं वहाँ लेके गई पेशेंट को, तो उनका ब्लड उतना गिरने की वजह से उनके साथ कोई भी जेंट्स नहीं था जो ब्लड डोनेट कर सकता था। जब मैंने डॉक्टर से बात किया कि वो क्या होगा ऐसे हालात में पेशेंट का, तो डॉक्टर बोले कि मैं देखता हूँ, कुछ करता हूँ। फिर उन्होंने फ्री ब्लड की प्रक्रिया अपनाई और उन्हें ब्लड चढ़ाया गया और उनका ऑपरेशन हुआ और अभी बच्चे और माँ दोनों स्वस्थ है। और जब वो डिस्चार्ज होके जाने लगे तो उसकी माँ और उनके पति पकड़ के पूरा बोलने लगे कि आपने एक फैमिली को बचाया है, आपने पूरे फैमिली को बर्बाद होने से बचाया। तब मुझे बहुत खुशी हुई। जीविका स्वास्थ्य मित्रा का काम करने से मुझे बहुत खुशी मिलती है।
नेक्स्ट वन।
मेरा नाम बीबी हसीना है। मेरे शौहर का नाम मोहम्मद आमिर है। मेरा दूल्हा टोटो टेम्पू चलाता है और हम बीकनपुर भागलपुर के रहने वाले हैं। उसी में मेरा गुजर बसर हो जाता है। शादी के बाद से हम परेशान रहने लगे, तबीयत हमारा ख़राब हो गया। फिर हम डॉक्टर के पास गए, वहाँ दिखाए डॉक्टर को। डॉक्टर मेरा जांच करी, बोले कि इसके लीवर में सूजन है। हम 1 महीना तक इलाज करवाएं अपना प्राइवेट में। उसके बाद फिर मेरे को बाबू रह गया। बाबू रहने के बाद हम 9 महीना तक ही प्राइवेट में ही दिखवाए। मेरे को पता नहीं था सरकारी के बारे में। उसके बाद फिर जब मेरे को रात में 9 महीना जब हो गया, दर्द स्टार्ट हुआ, तो डॉक्टर के पास गए। डॉक्टर कहने लगा हम डिलीवरी नहीं करेंगे, इसका अस्पताल में होगा।
any way of
परेशान हो गए,
increasing
घबरा
the
गए कि अब
volume,
मेरा
Rohan?
डिलीवरी कैसे, मेरा घर वाला परेशान हो गया। तो उसके बाद हम लोग अस्पताल चले गए। लोग यहाँ से भागलपुर मायागंज अस्पताल गए, वहाँ मेरे को दिखा। हम पूरी घबराए हुए थे, परेशान थे। तो फिर दिखा हमें जीविका का स्वास्थ्य सहायता केंद्र दिखा। वहाँ बैठी हुई थी नुसरत दीदी, जो स्वास्थ्य मित्र थी। अस्पताल जाने के बाद वहाँ जीविका दीदी से मिले। जीविका दीदी हमारा मदद करी, बोले परेशान मत हो, हम तुम्हारे सहायता के लिए हैं। तो फिर जीविका दीदी डॉक्टर से बोल के जांच करवाइन, हमारा मेरे को भर्ती करवाइन। और उसके बाद फिर डॉक्टर कहने लगा इनके बदन में ब्लड नहीं है, इनको खून चढ़ेगा। फिर हम लोग घबरा गए, परेशान हो गए, हमारा घर वाला कि अब हम कैसे क्या करेंगे। तो फिर जीविका दीदी हमारा मदद करी, बोली इसकी परेशान मत हो, हम तुम्हारा डिलीवरी अच्छे से ही करवाएंगे। वो हिम्मत हौसला दी हमें, मेरे घर वाले को, मेरे को भी। उसके बाद फिर जीविका दीदी हमारे खून का इंतजाम कर दी। मेरे को खून चढ़वाइन, पानी चढ़ा, मेरे को डिलीवरी हुआ, रात में अच्छे से डिलीवरी हो गया। उसके बाद डॉक्टर कहने लगा कि बच्चे को सूं पड़ेगा, हेपेटाइटिस बी पॉजिटिव मेरे को इन्फेक्शन था। तो उसकी वजह से डॉक्टर से जीविका दीदी बात करके फिर जीविका दीदी हमारा मदद करी, हमारे बच्चे को ले जाके अस्पताल में सुई भी दिलवा दी। बच्चे 2 दिन तक वहाँ भर्ती रहे, हमारा अच्छे से देखभाल हुआ। जीविका दीदी भी हमारा अच्छे से मदद करी, देखभाल करी। उसके बाद हमारा छुट्टी में भी मदद करी जीविका दीदी। वो डॉक्टर को बोल के अच्छे से दवा ववा भी दिलवाई, हमारा अच्छी तरीके से ख्याल रखा गया मायागंज अस्पताल में। उसके बाद फिर छुट्टी हो गया। उसके बाद अगर कुछ भी परेशानी होता मेरे को या मेरे बच्चे को, हम भी वहाँ मायागंज अस्पताल जाते हैं। जीविका दीदी की मदद से वहाँ मेरा अच्छे से इलाज हो जाता है, हम भी ठीक है, हमारा बच्चा भी ठीक है। हम जीविका दीदी को दिल से धन्यवाद कहना चाहते हैं।
We are happy to share one more documentary with everyone.
बहुत ही दिनों से हमारी सासू माँ के पेट में हल्का हल्का दर्द हो रहा था। तो वो बोल रही थी कि हमको डॉक्टर को दिखाना है। जब अभी हम 31 को हमारे हस्बैंड आए तो वो बोले कि हमको दिखा दीजिए उबैद अली को। तो हम बोले कि हमारे जीविका की तरफ से हेल्प डेस्क है वहाँ पे मायागंज हॉस्पिटल में, तो वहाँ दिखा देते हैं जा करके, आपको देखिए सुविधा हर चीज़ का वहाँ पे मिलेगा हम लोगों को। तो हम ले करके आए दिखाने के लिए। तो हेल्थ मित्रा हमारी बहुत तरीके से मदद, और हमें भरोसा था कि वो हमारी मदद करेंगी, इसलिए हम लोग यहाँ पे आए। तो उन्होंने हमारा चिट्ठा जा कर के कटवा दिया और उसके बाद डॉक्टर के पास लेकर के गई, डॉक्टर से मिलवा के चेकअप वगैरह करवाए, और जो भी जांच लिखे थे, इको का जांच समझिए कि एक महीने पे जो आता है नंबर, वो उन्होंने हमारा 1 से 2 दिन में ही करवा दिया। और जाकर के हमारा अल्ट्रासाउंड वगैरह सब जगह जहाँ जहाँ हमारी ज़रूरत थी वो ले करके गई दोनों, और वो उन्होंने हमारा हेल्प कर करके सब जांच करवा दिया। और 1 हफ्ते के बाद हमारा जो एडमिट करने का था वो एडमिट भी करवा दिए उन्होंने। तो अब एडमिट करवा दिए, और उसके बाद अभी डॉक्टर के पास से हमारा चेकअप हो गया, ऑपरेशन के लिए भी बोल दिया गया। अभी डॉक्टर ने ऑपरेशन थिएटर में गई थी वो, तो फिर डॉक्टर ने एक एंडोस्कोपी जांच की और उसके बाद बताएं कि इनका ऑपरेशन 6 वीक के बाद होगा। तो कुछ सूजन वगैरह है, वो 6 वीक तक इनका दवा चलेगा, ट्रीटमेंट, उनके बाद होगा। तो हेल्थ मित्रा को मैंने बताया, तो उन्होंने बताया कि ठीक है, आपको कोई दिक्कत नहीं है, आप एक दिन आज रुक कर करके सारा दवा वगैरह हम दिला देंगे, उसके बाद आप कल जाइएगा, फिर बीच बीच में आपको जब भी ज़रूरत हमारी होगी आ करके आप मिलते रहिएगा। और अच्छी मदद मिल रही है यहाँ पे उनके जैसे कि किसी चीज़ का किसी को पता नहीं रहता, हॉस्पिटल में आते हैं कौन चीज़ कहाँ पे है, जांच घर कहाँ पे है, तो कितने नंबर पे जाना है, तो वो साथ में ले जाके आपको सबसे मिलवा देती हैं और सब काम करवा देती हैं। ये मदद बहुत ही हुआ जीविका की तरफ से, जो ये हेल्थ मित्रा बैठी हैं, इसलिए तो हम यहाँ पे आए, वरना यहाँ पे तो आना इम्पॉसिबल है कि कुछ पता ही नहीं रहता, कोई इधर भागा दौड़ी में ही टाइम वेस्ट हो जाता, ओपीडी बंद हो जाता, फिर दिखाना मुश्किल है। तो उनके ही मदद से आज हमारा ये काम हो पाया है जो हम दिखाएं।
Thank you. So these are just a few glimpses of hundreds of such stories and anecdotes that we can bring to you of how lives have been saved just by this small intervention of having a help desk, which has made lives very easy for patients and people who come in distress. And on the other hand, you could also see the confidence and the sense of pride with which the Swaasthya Mitras were talking about the work that they do. So really remarkable intervention and amazing work. And we will definitely have more and more to share with all of you as this intervention goes along. So now as we move ahead, we will now have the last presentation from Dr. Pragya, who's the additional professor, Department of Community and Family Medicine, AIIMS, Patna. And over to you, ma'am, to share with us the findings of the evaluation that has been done, which is equally important for all of us to actually understand what went wrong and what are those corrective measures that we will have to take, because this is indeed a very, very beautiful intervention which has to go on. So over to you, Dr. Pragya.
Thank you, Irina, and hi, everyone. So I would like to present this qualitative finding, although the report is very big and we reanalyze it, but I am just presenting a very salient part related to this gender thing. So this, as all of us know that with the help of PCI and AIIMS Patna, the JEEViKA has taken this initiative, and then we trained those Swaasthya Mitra in approximately 6 months, and afterwards they have joined the respective places where they had to conduct the work. Next, please. So this was again, I think it has already been told, so I'm not repeating. Yes, next. So this was a mixed method study basically, where we analyzed the quantitative finding also and qualitative finding also. But here I would be presenting the qualitative findings. The two hospital, the district hospital in Jamui and the Jawaharlal Nehru Medical College, Bhagalpur, because it was the plan to start this help desk initially on these two hospitals, and then later it was expanded to all other places. So we have conducted this study only on these two hospitals, that is the Jawaharlal Nehru Medical College, Bhagalpur, and District Hospital, Jamui. And we have interviewed the beneficiaries, the Swaasthya Mitra, the medical officers, the Deputy Director Administration, which is the DDA, and then the Civil Surgeon of Jamui, and few other residents who were working in the Bhagalpur Medical College regarding the perception of this help desk and how it is helping to the overall hospital administration as well as the patient. Next, please. Next. So we have summarized all these findings under these 5 themes. So under theme 1, this conceptualization of Swaasthya Mitra was, here only. So we have taken the views point of the all the people who were working, and then they have suggested that the first theme was there are problems in the government hospital or the public health facility, because of which the patients, they don't want to go to these hospitals. And even if the person is having a less money, the first option is to go to a private facility, not to go to a government facility. So the first challenge is the navigation. So I would like Rohan to click on that. Yes. So one of the beneficiary told that in the government facility, we have to run here and there a lot. And because we are totally unaware of the structure, there are so many departments, we are completely clueless. So that shows that the navigation, especially with the elderly patients and the female patients, that's a challenging thing in the public health hospitals. Rohan, could you go back to the... Yes, thank you. The second part is the delay in initiation of treatment. So you just have heard that, by the time you come to know regarding the overall process, the registration desk is closed, or the doctors, they have already started going back to their home. So that's why a person needs 2 to 3 days to get accomplished. So there was a delay in initiation of treatment. Then again, the third point was there was a perceived fear of death, which initially also it was emphasized. And Rohan, could you please click on that perceived fear? Yes. So one of the beneficiary, they told that earlier we were very scared to go to Mayaganj hospital because we were having this perception that it's the end of the life. If you have gone there, you're not going to come back from that place. And that's why we were very scared. And when we heard that my sister is going to that hospital, we started crying and wailing. So that was the fear from the government health setup, especially in this case, it was a Bhagalpur Medical College. There was a communication barrier because as a doctor, we all know that many times we talk very scientific language, and the kind of patients which we face, they don't understand it at all. So this was again one of the problem. And there was a very big problem, that was the inadequate follow-up and care, because we all know that we give instructions as a doctor and the patient is unable to understand. So these were the few problems apart from many which they perceived, the beneficiary and the hospital administration. So there was a placement of this Swaasthya Mitra help desk. So could you please go to theme 2, Rohan? Yes. So I would like to emphasize on this empowerment issue. So when this Swaasthya Mitra, they were deployed at the help desk, so they have felt something like empowered. So the empowerment was done at 2 levels. The first thing is that empowerment of Swaasthya Mitra, and they have revealed that they felt empowered. And the second was the empowerment of the patients who were coming there. So the first thing is empowerment through the professional growth. So Rohan, could you please go to that slide? Yes. So the Swaasthya Mitra, they have said that living in the village, initially also they were interacting with the people, and now they are conversing with the prominent doctors. And if the patients struggle to communicate, they are confident enough to bridge that gap. And doctors also cooperate them and they feel empowered. So this was the verbatim of one of the Swaasthya Mitra. Please go back. The second was the embracing an all-rounder role. So this was again revealed by one of the Swaasthya Mitra, that now they feel that they are all-rounders in the hospital, because a nurse or sister might be restricted to one area. But now when they are interacting with so many departments, they have knowledge regarding many tests. Initially, they were not knowing regarding the LFT, KFT, many short forms which doctor use. But now they feel that they are all-rounders. Then third was, there was an enhanced job satisfaction. So one of the Swaasthya Mitra told that as in JEEViKA, she was working initially also, but she was working at the level of village. So there was an incident when a baby died after delivery and she couldn't do anything. But you have just seen in one of the video that how she helped one woman and that baby was delivered and the life of both the baby and the child, it has been saved. So right now at the level of Helpdesk, she has got a job satisfaction that now she can help people in a more empowered way. Yes? Can you please go back? Yes. And then there was a familial and social recognition. So the JEEViKA, she was now she is getting a lot of importance in the family, in her family. So this was one of the verbatim that since we started working here, we have gained a lot of experience, and during training also, the things which she has not known, now she has started knowing that, and because of that, she has got a, like in family, they used to say that this is our new doctor. So that recognition she is getting at the family level, and the same goes with the societal. So in around neighborhood also, now there is an increase respect for those JEEViKA members who are working as a help desk. Yes, can you please go back? And then again, regarding this communication barrier, the JEEViKA is now acting as a bridge. So like there was one verbatim, after I made the call, the patient asked, where should we go? So like JEEViKA, she receives a lot of call and then she guides the people where to go, even after understanding the prescription of the doctor, when to take the medicine, how to take, with water, empty stomach and all that, because now she is well versed with many of these things. And this communication which doctors, because doctor cannot sit with every patient for so long, so now she is proving to be her worth in counseling a few important things which she can do. So that's how she's overcoming the barrier. And then this was like this help desk is, or this JEEViKA Swaasthya Mitra is also fostering autonomy in the women's healthcare decision. How this was possible? Because in Bihar, you will see that generally the females are dependent on their husband to take the decision. If someone is not well, even if the mother-in-law or the wife herself, she will ask her husband to take her to the hospital. But now the women and the JEEViKA Mitra, Swaasthya Mitra, they are communicating with each other. And then they say that, Didi, I am coming and will you please help me? And this was one of the verbatim when this lady, she had taken her sister-in-law, and with the help of Swaasthya Mitra, she has shown her sister-in-law also in the hospital. So now she doesn't need to ask from the husband that when should I go, or will you be there with me to take care of me and to accompany me. So that was a empowerment of the patients also, especially the female patients, because generally it's the female who are the sufferer, because they are always dependent on their male counterpart. So this was a very beautiful finding which we found, that it is not only the Swaasthya Mitra, but rather it is getting transferred to the female patients and their relatives as well. Can you come back to the initial slide, Rohan? Yes, so if we can go to the theme 3 now. And here, after this, the Swaasthya Mitra, they were deployed at the help desk. So patient perceived that there was a reduction in the initiation or time of the initiation of treatment. The JEEViKA Swaasthya Mitra is doing the regular follow-up. Definitely, it is most of the time on phone, like asking her to come to the hospital after 3 days, or maybe if she's admitted there, going there every day, checking whether she has got the food or not, the medicines or not. And there was a decrease out of pocket expenses, because we all know that in private, if you go apart from the OPD consultation, many times there is a tendency to go for more surgery. So that out of pocket expenses, it was one of the very good outcome which we have found out in our study. And again, like it was emphasized initially also that the brokers, and there was a lot of there are a lot of stories in the Jamui district hospital regarding this cunning traps of the brokers, where they were moving at the night and they were asking Swaasthya Mitra not to entertain patients, and then there was some altercations also happened. But the Swaasthya Mitra, they were very brave, and they have just succeeded in getting over those brokers. Then coming to theme 4. So there was a benefits to the hospital. One of the most important benefit which the hospital superintendent and the medical superintendent, they have shared with us that now they have started having faith in the government hospital. And now with that name of Mayaganj and the district hospital Jamui also, the patient have, the fear has lessened now and the faith has increased in the government hospital. Can we come to the theme 5? Yes, but again, there are some challenges and support system for Swaasthya Mitra at Helpdesk. So because of the lot of record keeping, but now since we know that there is an app, so that there was a poor quality of record maintenance because they were not having adequate time to enter the data in the register. So they were doing that in the next day. So that there was an issue of accuracy with that. There was one more problem which was perceived by everyone in the hospital, starting from the health manager to the beneficiary, to the superintendent and to the civil surgeon also, that there was no coverage at night. As we all know, it is from 6 to 10. So if any emergency comes at night, so they were saying that if you have to do the work, you should do it in a comprehensive and holistic manner. Why you have left the night coverage? Because at night also we need such people. So that was again suggested by the administrator. One of the very important finding which we have come up, there were many doctors who were not aware regarding this cadre of Swaasthya Mitra. They said that we know that two women are here with a pink dress or coat, but they were not knowing that there is something known as Swaasthya Mitra is there, especially the residence doctors, because we all know that in medical college, the senior consultants, the more important cadre is the junior doctors and the senior, the first and second level of junior doctors. So the PGs or the senior residents. So they were not knowing regarding, they thought that it is something which the hospital has provided to them. So I think that's why those things need to, doctors should be communicated regularly regarding the presence of Swaasthya Mitra maybe. And Swaasthya Mitra also suggested that they should be included in the meetings of the hospital where all the workers or the staffs are there, because now they will be working under those hospitals. So they should be included. And then there should be frequent communication. The Swaasthya Mitra also should go and introduce themselves if it is not being done formally. So that can be done. And again, because of the increased workload, now the one Swaasthya Mitra is not able to handle all the work, because if she is accompanying some other patient, that help desk is empty. There's no one sitting there. So the other patient, they start making ruckus. So there is a need of one more Swaasthya Mitra in the shift because of the increased workload, because we now know that a lot of other responsibilities is also being given to these Swaasthya Mitra, like ambulance, managing of the ambulance services, etc. Then there's a need of refresher training, because initially they were trained when they have not exposed to the work, and now because they have already done the work, so there should be a refresher training of all these Swaasthya Mitra. And there should be some incentives also for these people, means incentive not in the form of money, maybe in the form of recognition, some certificate or something from the hospital side, so that they will feel motivated to work in the future. So these were some, I think, further quality improvement initiatives could be improved record maintenance, and that has already been done. And then again, expand the role of Swaasthya Mitra. So I have, I think, included all these in my previous slide. So it's just the repetition. So I think that's all from my side. Thank you so much.
Thank you so much, Dr. Pragya. Very beautifully presented. Very precious verbatims and meaningful insights, which we have all gathered from the qualitative study that you've done, and which, points to the fact that this kind of an intervention was the need, and it really needs to be continued in future as well. But at this point in time, it is also important for all of us to look at the challenges and also to look into how we can strengthen this particular intervention, make it more sustainable, and add more value to the services which are being rendered by the Swaasthya Mitra. Thank you once again, and I'm sure the challenges and the solutions that you've recommended would be of great help to JEEViKA, and they will definitely reconsider taking some corrective and additional measures to make it better. Thank you. And now I would like to call upon Dr. Pradhan.
Yeah, thank you so much, all presenters. I think this was like a whiff of fresh air. We know, like, I personally having worked in a hospital setting, I know that there's a lot of complexity in hospital work. And it is, surely when someone from a rural area comes there, and as a hospital person, I've seen they come to the government hospital as the last resort. And this initiative is trying to make, government hospital and public places not the last resort, but the first place. Because, in terms of the expenditure and the, supply side initiatives, government hospitals do have a lot of investments, and it is for the general public. I don't want to add any more to that. We've heard of that. But if any questions are there, any comments, any thoughts, I'd like to welcome. And also thanks to all our speakers once again. Any questions? I will just check the chat box if there is anything.
Yes, there is a question from Valerie. Would you like to read out your question?
Yeah, I can also read that. She's writing that. Let me go through it. There's some problem with the camera, that's why I'm not appearing, maybe.
Yeah.
But I'll just read I have a question directed to the Dr. Pragya, that we often observe that women from marginalized communities encounter discrimination when trying to access sexual and reproductive health services, particularly SRH services like safe abortion. This is compounded by the stigma surrounding abortion with these communities, where it is still considered taboo and it is only allowed under certain conditions. My question is whether you provide training to JEEViKA on the Medical Termination of Pregnancy Act and its intersection with the Protection of Children from Sexual Assault, that's the POXO Act, and the necessary steps to be taken also. There is a disaggregated data for the number of patients that JEEViKA Swaasthya Mitra has supported. If yes, then how many of them are trans person and women with disability? So I guess, yes, there are three parts of your question. So my first answer to this question, like training on MTP Act and POXO Act. So no, not at all. We did not provide them a training because when they came, they were very novice and naive, and it was a very initial beginning training. And there was a plan that after getting insights from few hospitals, we'll again reorient the training. But it was like JEEViKA, I think there was some need to place this help desk at every hospital. So yes, this was not covered. So this was my first answer to your first question. Then second, again, regarding the trans persons and women with disability, I don't think so that we have separated these as a data capture process, any special women in special need or some other special group. The recent this app, we have not reviewed yet, the recent one. Maybe after reviewing that, we will be able to answer that data on the trans persons and disabilities. So I think that is not there still, but maybe the JEEViKA person who is handling this data, they will be able to answer this regarding the third part of your question. So I hope if there are any other more queries, but I think this was the answer.
Yeah, so I think if Apollo's there, he can answer, but I can also take about the disaggregated data. Yes, data is being captured, and I think we are still looking at data analysis of all the data that's coming in. There are, issues of data aggregation initially because it was paper-based. And now with the new MIS, I think some data will be coming up. There will be, distributed data in terms of number of patients, age of patient, even gender. So we'll, as it comes, we'll be able to share with the larger community. So that's, I think, most of the questions by Pallavi has been responded to. Priya has a very interesting question on whether, what has been the response of Ashas and ANMs to Swaasthya Mitras. So I think my response to that was that this is a reasonably new initiative, at least in Bihar. the idea was initially to do only in Bhagalpur and Jammu to understand it and then to scale. But I think on the part of the government, even at the level of the chief minister, there was a lot of, intention to really scale this up. They saw value in it. And within a couple of months, it has been scaled to all the medical colleges and all the district hospitals of Bihar. But still, coming back to the question, this Swaasthya Mitra has been popularized in two ways. One is because of their own visibility at the Helpdesk, which is right at the hospital entrance. And other is that the names and the numbers are being sent to JEEViKA groups so that JEEViKA members are able to know that if they go to the hospital, they will have someone there to help them. On the part of the health system, the ASHAs and ANMs are not totally aware of this. ASHAs and ANMs, as you know, are peripheral field workers of the health systems, and they're large in number. I think we have got about 1 lakh ASHAs and more than 30,000 ANMs in Bihar, around that number, I would say. And but this concept will be popularized amongst ASHA and ANMs slowly, but not as of now. Some ASHAs who bring patients to, particularly delivery patients, to medical college hospitals and to district hospitals, were initially apprehensive of who is this new person who's helping them around. Their apprehension was really related to their, incentives. They were afraid that some of the delivery incentives would actually go to the Swaasthya Mitras, which was not the part of the program. So when they realized that these people were not to take ASHA's incentives away, but rather to help them, I think their fears were allayed. So this is what I know. Maybe if there is more information from elsewhere, I'll put them together. But these are a few incidents that we've heard between ASHA and the Swaasthya Mitra interaction. So we are open to any other questions. I think we have passed our time also. So by looks of it, some people may want to remain. Yeah. Swaasthya Mitra compensation. Apollo, would you like to answer that? Rakesh or Apollo, if one of you is there. Yes, Apollo. Apollo is the SPM of JEEViKA. He leads the health and nutrition entire, and he's the man who's really been, helping the nitty-gritties of the Swaasthya Mitra. So I think he will have the answer to this. Over to you, Apollo. Apollo, you're muted, so please unmute yourself. Yes. It's still on mute.
Yeah, now on mute.
Please repeat the question again.
Hello. Hi, Apollo. My question was, how do Swaasthya Mitras get compensated for their work, and what incentives do they have to do the work that they do?
Basically, the incentive we have given provision for Health Mitra, that is per day basis. This is skill labor cost. This comes around 495 rupees per day. So it is good compared to the other community cadre that now we are giving in JEEViKA. This is comparatively good incentive that we are providing them. So total around 25 days. This wage labor based we are giving. That's why we are calculating for 25 days incentive under this skill labor rate of the incentive. So I am I audible? My voice is going on.
Yes, yes,
thank you.
So have I answered you?
Yes, thank you. This was useful.
So thank you, Dr. Pradhan. If there are more questions, people can always reach out to PCI India or to JEEViKA with their queries. We will close the session for the day. And once again, I would like to thank all the presenters who were present with us today, and also everyone who joined the session. This has been very, very encouraging, not only as an intervention, but also as a topic for all of us to deliberate, discuss, and take this ahead. Thank you, everybody. Over to you, Rohan, for your last
Thank
words.
you so much. Thank you. Yeah, this has been, like Dr. Priyadas says, most insightful to hear, not just from the leadership to get a sense of the guidance and the vision with which this was created, but also hear voices from the field. Thanks so much, everyone. We're 9 minutes over. Thank you for staying back. And we're really, really appreciative of everyone's time and work that has gone on to make this happen. Thank you. Thank you, Dr. Irina. Thank you, Dr. Narottam. Thank you.